Good evening, everyone. Uh, it's really a pleasure to meet you all again here. And I know so many people who attended all the other sessions, previous sessions. They also join, and some new faces also I can see. And it's also a very pleasure to welcome my good friend and physician and a scientist, Dr. Anandaraman Sharma. I know him since his early times in Amrita University as a faculty and also a person heading the panchakarma department and also taking care of the entire hospital activities. And since then, I know how involved he was in both teaching as well as research. And yesterday, we heard from Dr. Ram Manohar how he was questioning the Ayurveda concepts and all those things. And I can certainly say that Dr. Anandaraman Sharma also keep that sort of a what I can say that kind of a mindset of a real Vaidya scientist who is interested in questioning the fundamental aspects of Ayurveda, through which he is also learning new things. And today he will be sharing his experiences of teaching and research through this title, excellence in teaching and research. And um and being a senior faculty in AIMS, I'm sure this is going to be a really kind of an informative session for all the aspirants who are attending this course, who are interested in knowing what to do after BAMS, and also there are people who have completed their BAMS and MD, for them how to take their profession forward. With that small introduction, Dr. Sharma, we are very happy to invite you for this session once again. And over to you, Dr. Sharma. Thank you.
Namaste, namaste. Namaste to all. Praying to the lotus feet of Lord Dhanvantari. And today it is indeed, we should remember the great soul, M.S. Valyathan sir, in this evening, because day before yesterday only he passed away from this world, who contributed the concept of Ayurveda biology and contributed a lot to Ayurvedic scientific research by through literature and conducting research and empowering the Ayurveda physicians. So we should pray for his soul. And with these words, I thank also again my good friend Sri Vishnu Prasad sir. We were good colleagues, even though we were in two institutions at Amrita University at Kollam, Kerala. And but still we had some interactions in between because of the same. The common point is research. Research, there is no boundaries for the research. That's what I feel. So because the Ayurveda can interact with biotechnology, or biotechnology can interact with Ayurveda, or any streams. So only thing is there is an inquisitive mind should be there, curiosity should be there, like a child. Because in your olden days, in your childhood, you might have, you can recollect whenever you get a new toy presented by any of your relatives, father, or anybody. So within second day, you will try to open it and see inside what is happening inside, right? So that kind of curiosity we should have always, so that we can succeed in our life. We can succeed with good research outcomes. So today, the organizers requested me to speak about my career progression, or the education backgrounds and all, so that I don't know whether it can inspire you or whether you can learn something from that, but still that was the request from there. So I will go through my the study timeline and the researches what I have done, the areas what I have touched during my small career of 17 years of teaching career, and around 25 years of professional career, and the patients through whom I gained the knowledge, etc. Okay. So currently I'm working as the professor and head of the Department of Panchakarma and medical superintendent at All India Institute of Ayurveda, New Delhi. As you know, All India Institute of Ayurveda is a autonomous institute and apex institute under the Ministry of Ayush. So the timeline as it shows my pre-degree or +2 I have done from science background from Christ College in Nyalakuda. And till that, my father was a physician, Ayurvedic physician, who was a Vishavaidya also, toxicology practitioner, trained, professionally trained, academically trained Vishavaidya. And he was in government service at Kerala government and retired as the district medical officer from the government of Kerala. So after his retirement, he was started his own practice at my village. So during my 10th or during my pre-degree or +2 time, we used to go to the Vaidyashala or the Ayurvedic shop where you do the consultation and the medicine also will be dispensed. We used to stay there in the evening hours around 5 to 6 or 5 to 7 to dispense the medicine, because evening time there will be a lot of crowd for the consultation. So we used to, myself, my brothers, we used to stay there. That was my first interaction with the Ayurveda. So how the medicines will appear, what are the dosage forms. It is a practical. I don't know, at that time, I don't know anything about the medicines or its potency or its action, but only the name I used to learn at that time. So then completed my pre-degree, and I never tried for any medical MBBS entrance or anything. So my intention was to do the BAMS only, Ayurveda, to learn Ayurveda only. So I didn't try any sort of such entrances, and I joined KVG Ayurveda Medical College, Sulya. It is in Karnataka under Rajiv Gandhi University, and completed my undergraduation in 2001. And after that, I had a passion to teach others, teach my classmates, juniors. So during the internship itself, I started to teaching the Padartha Vijnana and Ashtanga Hridayam. So after that, after the completion of internship, I joined the institute, same institute in my alma mater, and started to teach Ayurveda to the students. And around 2 years I worked there as the tutor, because at that time there was a provision of BAMS graduates also can teach as a tutor. So I was teaching, I was a tutor at KVG Ayurveda Medical College for around 2 years. And after that I thought I should quit teaching and I should practice. So I joined my father for practicing. And till 2004, I was with my father learning the private practice and in his own clinic. And then I thought I should learn little more about panchakarma. My father was even though he was a Vishavaidya, he used to practice the panchakarma very effectively in OPD basis also, because we don't had any inpatient facility at that time. So hospital was not there. So on OPD basis, he used to practice some of the panchakarma. So I thought I should learn more about panchakarma. Then I joined the SDM Ayurveda College for MD Panchakarma at 2004 and completed my post-graduation at 2007. Okay. And after completion of Panchakarma MD, and I joined the Amrita School of Ayurveda as a assistant professor or lecturer in 2007. And from there, my professional career starts. And I served the Amrita Institute till 2021. From lecturer to professor, my different phases of my profession was shaped and nurtured at Amrita. Okay, so during this period, I have joined for the PhD under Sarvepalli Radhakrishnan Rajasthan Ayurveda University at Jodhpur, and completed, awarded with a PhD in Ayurveda in Panchakarma in 2015. And while my career at Amrita School of Ayurveda, I have joined awarded with a fellowship also, transdisciplinary research fellowship in traditional medicine, offered by Department of Health Research and organized by Savitribai Phule Pune University at Pune, under the chairmanship of Sri Bhushan Patwardhan sir and Dr. Girish Tillu and Supriya Balarao and many others were there during that period, and Vishnu Jogalekar, etc. So this was my career, education background, and during this educational background period, one thing I want to remind you that I didn't had any Sanskrit background. So many of these Ayurvedic students, BAMS students, they complain that we don't know Sanskrit, and first time I'm learning Sanskrit, so it is difficult to learn shlokas, difficult to understand the Sanskrit verses and all. So same was with me also. I didn't had any Sanskrit background. I never learned Sanskrit academically. Only touch with Sanskrit was chanting the shlokas or mantras because of the religious practices. That was the only touch with the, but I didn't know the meaning of the shlokas and all. So after joining BAMS, I also felt the same difficulties to understand the Sanskrit shlokas or the verses in Charaka Samhita or Ashtanga Hridayam and all. So to overcome this, and learning the Sanskrit grammar is also was very tough for me. So I was little behind in that learning grammar also. But I picked up Sanskrit only because of the Ashtanga Hridayam Arunadatta Vyakhyan. Okay. And the commentary of Madhav Nidanam. These two things helped me to learn Sanskrit and understand the sloka in a better way. So I used to learn the Ashtanga Hridayam and read the commentary, even though I didn't understand any meaning initially, but slowly, I picked up the meaning. Once I read the commentary of Arunadattam and read the Malayalam version and understand the meaning. So within 3-4 months, I learned to picked up the Sanskrit little better, and now I can interpret, or at that time of my final year, I could interpret any Sanskrit shloka in Charaka Samhita or Ashtanga Hridaya in a better understandable manner. Even though I didn't understand the grammatic part of that, but in a beautiful way, I could do the Sandhi Vicheda and Anvaya and all. So the only thing is we should have a passion to learn the things. So we should continuously try for the same. I didn't mean that we should go hard work reading 24 hours and all, because I was engaged in the extracurricular activities also, and many other organizing the medical camps during our BAMS days itself. So along with that, the learning was also there. So learning these two commentaries, very simple way they have written. So try to read daily at least one page of the Ashtanga Hridayam and commentary, and try to learn its translated version, any of your language, either it in Malayalam or your native language, whatever it may be, or even Hindi or English. So you can compare the Sanskrit word with the translated version. So within 2-3 months, you will be able to learn. Only thing is, uh, many times I have seen that the students, while reading the Sanskrit shlokas, find it difficult to read itself. That is the main problem. If you are not able to read a Sanskrit shloka, it is far that you could understand its meaning. So first thing you have to do is try to read the shloka in a proper way with the proper swara shuddhi or proper pronunciation and doing the padacheda. Okay, so if you could do that, it is the rest of the things are very easy, and remembering or the memorizing the shlokas also would be very easy. Unless and until you are able to properly read, how you could memorize it, how you could understand the shloka, how you could recollect the shloka. Okay. So after my BAMS, I joined my practice with my father. So it was a great experience. He was my first guru, and I believe that knowledge what he shared to me during these practice days. And he never forced to do something or do learn these things. But every time there will be something or the other thing could be I could learn from my father during the practice days. Okay. So after the practice, father also suggested you should do the post-graduation. So that is why I joined the PG, and my interest was in panchakarma. So I chose panchakarma as my postgraduate top subject and branch. Then learned the panchakarma from SDM Ayurveda College, Hassan. Okay. The speciality of SDM Ayurveda College Hassan is it is one of the very premier institute. Still, we like to go back to the PG days because there was a lot of patients to see. There was a lot of panchakarma procedures happening day to day, and we need to manage the panchakarma theater, and we need to perform the panchakarma procedures at that time because there were only few PG seats were there. So postgraduate students were very less at that time. So daily, at least, we used to reach the Panchakarma theater at 6 o'clock in the morning, and up to 1 o'clock, I'll be in the theater only to learn the Panchakarma or to perform, to manage the technicians. And after that, after lunch, we join in the department for the discussion part or the presentations and all. This was the routine. And during the Vamana days, if Vamana procedure is there, I used to go there at 4:30 in the morning. And Hassan is a very beautiful place. In the morning hours will be very cold, chilled in nature also. So morning 5:30 we go, 4:30 we go there and prepare for the Vamana, and Abhyanga will be done for the patient by ourselves. Sometimes other side there will be technician. Some of the juniors or seniors will join. And after that, around 8 o'clock, we will finish the Vamana and go back to the room and for freshen up. So these kind of activities was continued for 3 years during the postgraduate studies. So continuous practice, continuous watching, monitoring the Panchakarma procedures, continuous monitoring the patients, taking the care of the patients continuously throughout the day. This gave a abundant confidence. So at the time of my final year, till the last 1 week also, I was in the Panchakarma theater. I salute to pay salute to my guide, the respected B.S. Prasad sir, because his words, his guidance gave me a wonderful future, also wonderful pathway to my further career growth. So with this continuous practice and experience, there was an abundance of courage, or the confidence was there at that time. So that is why for the final year Viva was, I was not at all worried, or I was not at all feared to face the Viva panel or the exam panel. So whatever the questions I answered with boldly, because in Charaka Samhita also, Acharya Charaka in the Agrasangrahaniya says, Anabhyase Bhayakaradam. Anabhyase Bhayakaranam. That means Anabhyasa. Abhyasa means practice. Anabhyasa means without practice. Bhayakaranam, it is causing the fear. So if you don't have any practice, it will cause the fear. If you have the practice and the experience, no need to fear, no need to worry. So that is even mentioned in the Charaka Samhita also. So simple example I will tell. If you want to practice the basti, the enema therapy, if at all you have not practiced or seen the enema therapy, and if anybody asks you to administer the basti, you will hold the basti netra, and when nearing to the rectal opening of the patient, your hand will 100% it will shake. Based on the shivering, or based on the intensity of the shaking, we can understand that how much practice you have, how much experience you have in administering these kind of therapies. If you have seen once or you have tried to administer 3 to 4 times, the intensity of shivering will be little less, but still it will shiver, shake. So the abhyasa or the continuous practice is very much essential. So that is why I tell to my postgraduate students also uh, during the internship and during the theater postings, I ask them to do the procedures. So sometimes the students feel that yesterday also I have done a abhyanga. Why should I repeat it? I know abhyanga should be done in 7 posture. These are the strokes. Why should I repeat it today also? But each and every patient is different. Each and every condition is different. Each and every climatic situation is different. So that is why repeatedly when we do, you will gain the confidence and you will master over that art. How the hand should fall on the patient while doing massage. How much pressure you need to exert. With which oil, how much pressure, how much force, how much speed we have to keep. So these all things cannot be learned theoretically. This can come through only practice. So that is why whenever you get any opportunity during your study period to perform any sort of panchakarma procedures, not only panchakarma, any sort of intervention or the clinical activities, don't hesitate to do that. Don't think that the other person is not doing, why should I do? Don't think like that. So involve in that and perform and learn about that. After doing the procedure, go back and read about that procedure so that it will strengthen your knowledge also. So that it will never you will forget the theoretical part also. Okay. So after the post graduation, I thought that I should join such an institute for the teaching where I should not sit idle. I should be busy all the day. So that was my thought process after my post graduation. So then I learned about Amrita School of Ayurveda under the blessings of Mata Amritandamayi. So I joined Amrita School in 2007, and there I worked till 2021. So there I established the Panchakarma Theatre along with my wife. And after joining Amrita, I married to Dr. Pratibha. She was also a Panchakarma faculty only. So there we worked together also and established the department together and taught the students. And till 2013, there was no post graduation. So we taught undergraduate students. So many of these students are now practicing themselves. They established themselves hospitals also. So at that time, only thing what I observed in Kerala, because the Amrita school was in Kerala. At that time, even though Kerala is famous for Panchakarma, but the more concentration was on the Kerala Kriyakramas. Kerala Kriyakramas like Shirodhara, Abhyanga, Pirichil, Navarakiri, and all. So the actual Panchakarma, the core of Panchakarma is the purificatory procedures, Vamana, Virechana, Basti, Nasya, Raktamoksha, etc. So there was no very strong practice of these Vamana. Virechana was performed in OPD basis or some of the practitioners. The Vamana practice was very less at that time. So I started to practice Vamana and tried to popularize Vamana and started the Vamana camps. And many of the students from the government institutes, Trivandrum or Kannur or Tripunithura, they used to call me for ask about the doubts regarding the Vamana, because the Vamana was not performed in these government institutes at that time. But later, the Vamana got popularized and many studies also happened in Vamana. And my PhD study was also on Vamana. And then slowly, the Vamana is now in many institutes. They do the Vamana Vasanta or Vamana camp for the healthy individuals now in Kerala also. So, continuous indulging in some activities for a longer period with consistency, that is also very important. To start the Vamana camp is easy, but to continue it in every year, repeatedly, without fail. Now also I conduct Vamana camp at All India Institute of Ayurveda also since last 3 years. After leaving Amrita, I continue this here also. So this gives your interest or passion towards the science. Okay, so after 2013, the postgraduate studies started at Amrita also. There was a post-graduation in Panchakarma also. And later we started to do the actual research. Till that time, the research what we doing at Amrita, because only undergraduate study was there, some small clinical trials without the proper IEC, Institutional Ethical Committee, or the CTRI and all, some internal clinical audit, we can say. Such kind of things we were doing. The documentation was done for the Vamana. That is why till now I might have performed more than 5,000 Vamanas in my career. And when the postgraduate study started, we started to involve in the research also. So I thought that when we start any sort of research, there should be a proper question. So we should have the question in your mind. How the question will come? The question will not come from the air, or the somebody will pass to you any questions. The question should be your own question. You should have a question in your mind. How the question will come? When you practice, when you perform the procedures, when you see the patients, when we read the text, when you read the different articles, then only the question will come. So that is why the existing knowledge, understanding of the existing knowledge is very essential, and a thorough involvement in the clinical practice or the performance of the Panchakarma procedures is very essential. Okay, so then you will get some difficulties during the practice that will turn into question. So try to try to search the answer for those questions with a different modality, different methods. That is called research. So to seek the answer for any questions, there is no boundaries of knowledge systems. You do not worry that to understand that question, I should search through only Ayurveda. It need not be. You can search through chemistry, you can search through mathematics, you can search through mechanics, you can search through biotechnology. So there is no boundaries for the knowledges now, because it is a era where we are passing through. All the knowledge systems are in your fingertips. You can learn biotechnology. You can learn Ayurveda biology. No need to go for any institute also. With your mobile only you can learn. Only thing is you should devote some time. You should have a inquisitive mind. You should have open your mind to receive these kind of systems. So that is why to reach to the goal, we should adopt any possible ways. That is called the transdisciplinarity, right? Transdisciplinary university also stands for that. So the Ayurveda also says that the prama is yadhartha jnana, the true knowledge. To achieve the true knowledge, there is no barriers. That is the thing. So only thing is we should search and identify which way we have to travel, or what are the things we have to incorporate. Okay. So that is why I thought that simple clinical efficacy studies should not be done continuously, because Acharya says that Erandamuladi Basti is effective in Gridrasi, or the sciatic pain. And again, I am going to do the research giving the Erandamuladi Basti in sciatic patient, and says that then Erandamuladi Basti is effective in sciatica. So that's also required, enforcing the results. So instead of that, we should try to understand the mechanism of action of why it works, how it works. These kind of things. The questions are important. That's why in the starting also, Vishnu Prasad sir, the importance of question. We should ask the questions. So in the Charaka Samhita, there is a wonderful verse in the commentary of Siddhisthanam first chapter. Acharya Chakrapani quotes Bharadwaja. Apradushtena bhavena prasannena antaratmana shishyena samyak prishtasya gurur buddhi prakashyate. This is about question. Apradushtena bhavena, without any negative intention. That is the first quality for a question. Without any negative intention or bad intention. Apradushtena bhavena prasannen antaratmana, with a open-minded, with a pleasant mind, without any bad intention, from a pleasant mind. Shishyena samyak prishtasya. If a shishya asks, samyak prishtasya, properly framed question. Irrelevant question also not acceptable. Irregular. So properly framed question. Properly framed question, how it will come? If you have a proper difficulty, then only the question also will be proper. So that is why in the research methodology also it says that framing of question, there are some guidelines. So Shishena Samyak Prishtasya. What is the benefit of this kind of question? Samyak Prishtasya means properly asked question from a pleasant mind without any bad intention. That question will ignite Gurur Buddhi Prakashyate, ignite the intellect of the teacher, not the student. That is important. Because when you ask a proper question, sometimes the teacher may not be able to answer that because all are not encyclopedias. So but it becomes his liability to answer the question later. He has to work hard, learn about that, and come back to you and answer that question. Okay, so sometimes in your classes you might have tried that. Today the teacher, I think that today the teacher is not prepared well. So I will ask a tricky question to trouble her or him. So I also done this during my undergraduate days. But it is not beneficial for either to teacher or student, right? So that is why the questions are very important. Try to ask questions and learn the knowledge. So after the post-graduation, done the PhD, and then I have become the associate professor at Amrita, and I have became the professor at Amrita. The Amrita Institute of Amrita, School of Ayurveda at Amrita Vishwavidyapeetham, because the place where we work also very important. The choosing the institutions. Why we should choose the best institutes to work? Because that will shape your career also. Why? Because the environment, the atmosphere where we work, if it is not healthy, if it is not very academic or research oriented, then there will not be any growth. If it is a very dull college without any post-graduation or without any research orientation, in such college, if you work for 10 years, also you will be in the same status. You will not progress in your career. You will not gain any knowledge. Because when I worked in Amrita, so the post-graduation came, so I should work more on the research aspects to guide the students, so that I should go for the PhD further to guide them further, to learn more about the research methodologies. And the university, it was a deemed university and NAC accredited. So that is why a lot of emphasis was on research also. So when the fellow colleagues are doing the research, so a healthy competition also will come, so that we should work with them, collaborate with them. We should think that better than his work, I should do, contribute to the science, I should work. So these kind of atmosphere, healthy atmosphere, that is also very important. So really at Amrita, uh, the atmosphere, the research and academic atmosphere helped me to shape my career also. So once I felt at Amrita also, even though I have done these kind of things, I worked hard, I see a lot of patients and do lot of presentation, national and international presentation was also I have done, and few publications in good index, PubMed or Scopus Index Journal, but still I am still at Amrita only, or I am still at the state of associate professor or professor only. There is no growth. This kind of thought process came to once in my mind also. Then I called my guide. Whenever I get some problem or some tensions in my life, so I call my teacher, B.S. Prasad sir, Now he is the president board of Ayurveda at NCISM. So I told sir, even though these kind of things are done, but it is not get recognized. This kind of thought process came to mind. So I told, no need to worry. Whatever you do, Ayurveda is such a science. Kuchit dharmaha, kuchit dattaha, karmabhyaseti, kuchit cheti. So by learning Ayurveda or practicing Ayurveda, sometimes you will get artha, money. Sometimes you will get experience. Sometimes you will get the dharma also. Dharma means the good deeds which will beneficial for the after the death. So dharma also you will get, artha also you will get, or karma abhyasa. Of course, when you perform 100% you will get this experience. So sir also told the same. No need to worry about the benefits at the present time. You don't think about that. Do whatever you are. You are doing good job. Continue to do that. Don't worry about the anything. The result will come later also. So that was his words. So I was happy, and I continued the works. And suddenly there was at that time there was many calls from the advertisement for the call for the government jobs in various other institutes, Jaipur or the Jamnagar and all. But I didn't apply it because I thought I should not leave Kerala and I should continue at Kerala. And last the advertisement of All India Institute of Ayurveda came, and I applied, and I came to Delhi and attended the interview, and I was selected for that, the post of Panchakarma professor at All India Institute of Ayurveda. So it is one of the Apex Institute, one of the highest post I can get. Any of the Ayurveda doctor can get at present, and I was appointed as the professor at Department of Panchakarma and head of the Department of Panchakarma also. And interestingly, I am the youngest professor at All India Institute of Ayurveda. Okay, so this is not because I suddenly came and they impressed with my appearance or my presence, and that's why they appointed. No, it's because the last 14 years, what I worked at Amrita or various other institutes, in KVG also I worked as tutor. So these experiences, the contributions to the Ayurvedic science, that helped me to reach to this place. So currently I am working as the Panchakarma professor and head of the department. And after joining All India Institute of Ayurveda, within a year, director of All India Institute of Ayurveda, Dr. Tanuja Nesri ma'am, she appointed me as the medical superintendent of the hospital. And All India Institute of Ayurveda is a tertiary care hospital with a 200 bed facility, and the IPD is 200, and outpatient facility every day around 2,000 patients will visit the hospital with various integrative units, and around 43 outpatient units also in different specialty clinics are there. And we have a small ICU and NICU or operation theater complex, and the co-location of around 12 to 14 modern allopathy doctors also there, and on-call doctors around 22 modern doctors are there, around 52 faculty members, and consultants are there, and in the hospital around 600 staff are there, paramedical, medical, cleaning, security and all. Okay. So primarily, I was concentrating on the research topics, research at All India Institute of Ayurveda, and streamlining the Panchakarma theatre, Panchakarma facility, and all. So now it is moreover the administrative role, because I am the medical superintendent of the hospital. So I have to do the HR management, and because around 600, I told 600 staff members are there. So monitoring them, managing them, and even the security comes under the medical superintendent, and administration, the day-to-day administration of the hospital. Because the budget of the All India Institute of Ayurveda is around 230 crores per year. So in that, the major part of the budget is spent at All India the hospital part only. So all the procurements related to the hospital, medicine, etc., are done through the medical superintendent office only. So even though we have a very good administrative unit, administrative supporting staffs at All India Institute of Ayurveda. So in between, I do my patient care because I sit in OPD for 2 days. And in the last year, maximum number of patients were admitted by me only in this hospital. And the postgraduate teaching, because this is a postgraduate and PhD training institute. We don't have the undergraduation here. So that is why postgraduate teaching is also there. The training for the PG scholars and presentations and discussions and research-oriented works. So apart from that, because it is very near to the power capital, that is Delhi, so and ministry is also in the same place. So that is why a lot of other administrative aspects related to the Ayush ministry also come to All Indian Institute of Ayurveda. That will be shared to my office also. And apart from that, the lot of VIP and VVIP. So VVIP in the sense ministers or the MPs and judicial judges, etc. They also come for the visit sometimes, or sometimes they come for the consultation. So daily one or the other VVIP persons or patients will visit All Indian Institute of Ayurveda. So that also I have to attend. A typical day, if you ask at present, morning 8 o'clock I start my work, because I come to the hospital at 8 o'clock and do my clinical rounds of the patients. And 2 days, as I mentioned, I have OPD also. If OPD is there, I directly go to OPD at 9 o'clock. And before that, do some administrative rounds in the hospital premises, patient waiting area and all. Then I go to the OPD and sit at 9 o'clock. And the OPD will end up around 2 o'clock or 2:30. Okay. So this is the OPD days. And other days, the morning rounds will be done. 9 o'clock, I will come to my office and sit. There will be a lot of files will be waiting for me, physical files. So I have to send that. Many of the indents I have to sign. So that I will do. And by that time, some of the other people will come for discussion or with some problems, some complaints. So that have to sort out. And there will be some appointment for the patients daily, at least 4 to 5 patients, VIP patients will be there, secretaries from different ministries or MLAs from the neighboring states or the MPs. So based on the appointment, I have to see them also. And after that, there will be, the administration is almost e-governance now at All Indian Institute of Ayurveda. There will be many files in the computer also, e-office, it is called e-office. So in the e-office, the files need to be checked, corrected, and forwarded for further approvals and all. So that I have to do. Because if one day also, if the files are pending, that will slow down the entire process. So the procurement or the salaries of the staff, many things will slow down. So,
sir, I'm sorry to interrupt, but we will normally close at 8. So
yes, 5 minutes.
And we want to give some time for questions. So if we can stop here and then we can take
100%,
questions.
100%.
Thanks. So thank you so much. I think you're echoing what Dr. Ram Manohar said yesterday about curiosity and always being curious, no matter which science you're looking at, and breaking away from those silos. So unfortunately, I asked Sir to not to skip a couple of slides, but audience, please ask your questions, put them in the chat box. It's a good opportunity for you to understand how it is to work in administrative come research come teaching role. Dr. Sharma has told us how he got there, but there must be a number of challenges that he has faced. So I welcome you to ask those questions.